Dr. Ahmed Ghana joins us now. He is the Commissioner for Health, Gombe State. Good morning. Thank you for joining us today. Well, we've just heard some part of the challenge that the state is facing about community policing, even though, I beg your pardon, community transmission. This is not getting off my head, this policing matter. But we need to be secure, don't we? So what can we do without our police here? But then, what is the approach now? Because I mean, when you hear the NCDC and several other people speak about what they want to do about community transmission, community testing or targeted testing. So at the moment, how is the state approaching this?
Well, thank you very much. I think you've said it very rightly. We've gotten to that stage of community transmission in Gombe State. It's quite worrisome. We have been trying to avoid that from happening, but unfortunately, that is the evolution and the progression of the disease. And currently, what we're having is clearly community transmission. And what we're doing, starting from within the government setup, we had a death within the task force. We're not sure where he contracted that infection from, but most likely it's either of two, from the task force meeting area because of the movement of the rapid response team within that locality, or probably from the community because obviously there are cases that are coming, into our fold, of which there are no histories of travel, and which means, the infection is now spreading within people. And of course, with the partial lift on, religious practices and, congregations involving many people, it's very likely that the people that already have the infection are spreading it across to other citizens. So what we're doing now is ramping up our community, mobilization, our community engagement, so that people become even more aware of the dangers of COVID-19, particularly in Gombe State. And what that means is that individuals, groups, and communities will have to take responsibilities. The government cannot on its own alone handle this issue. We have done everything to provide, the basic requirement what people need to do in terms of ensuring personal hygiene, washing their hands very frequently with soap, ensuring social distancing where they sit and where people have, signs and symptoms of COVID, that they should go into self-quarantine or quickly report, to health facilities. And we are going to continue with that. And we're also ramping up our testing, particularly in areas where we have evidence of the transmission happening. The unfortunate incident that happened within the government cycle, one of the directors who died, the facility has been shut down completely and contact tracing, implemented, and samples were taken of all the people that had come into contact with him. And the entire complex also where the director, worked, has also been closed down. Samples have been taken of all the names of people that have come into contact with that person. And generally, high-level officers working within the government cycle, including honorable commissioners, advisors, senior special assistants, permanent secretary, and so on and so forth, have all been line listed and samples have been taken. So we're kind of really ramping up our testing, initially from within the government cycle. But of course, we're also going to have targeted kind of mass testing within communities where we have full evidence of such transmission happening. It's not going to be an easy task, but I think that is the only way to get about, bringing the curve down. Once you get to that level, then it becomes a little bit challenging.
Now, let me ask, yes, this government has identified this challenge and then with a view to, of course, solving it. What about the people? How are your messages? Are they resonating with the people properly? Are the people on the same page with you so they don't frustrate all the efforts that you're putting in place if they don't see any reason why they should conduct themselves in a certain way?
That's really a very huge challenge. And I think that's not just limited to Gombe State. It's generally a problem across Nigeria. And I think to some extent, even across the globe, many people are still very skeptical about in fact, the existence of COVID-19 as a disease, entity. Some people think it's just a kind of a ruse, a deceit that people are putting forth, especially within the health sector. But the reality of the matter is that people have started dying within communities. The number of deaths that have been reported from most of the states are not actually a true reflection of what is happening, because people still don't believe that COVID-19 exists. So many people are not reporting, things that are happening in the communities. And this is really, a very huge problem, because as long as, people are not identified, those particularly carrying the virus, what it means is that they're going to remain within the communities and they will continue to transmit the virus across. And then the curve would continue to grow and go up, and it becomes extremely very difficult. So our messaging has completely changed now from, urging people to now really of stressing and overstressing, and all stakeholders, have been brought on board, including, religious, traditional, and all the other social levels of people that we have, so that people understand that this is not a joke. It's a very serious matter, because it's a matter of life and death. If you say you don't believe in COVID-19, and then of course you find people that are dying close to you, then what that calls for is that you need to really buckle up and be more serious, because government cannot be everywhere, especially at the household front or within the communities. So communities have to take that responsibility, reporting, unusual, or unexplained dates within the communities, and making sure that health officers are there quickly, to take charge of procedures. Otherwise, even handling dead bodies will become another big problem, and another very potential source of transmitting the virus across the, people in the communities. So it's really a huge challenge, and I think it calls for a multi-stakeholder and a multifaceted kind of approach, including the government, community leaders, the media, civil society organization, and all the various channels that we can use to get people to understand that this is really the time for everyone to be part of the whole process. All hands must be on deck at the family front, within the local community, the local government, and the state, and the nation in general. So once you have community transmission in states, then that's really the peak of the problem that needs a very close management and meticulous handling of the whole issue in a very strategic manner.
I think one of the things that will be very key to you, getting this under control is the number of testing you're doing. I know you referenced testing earlier on, and I'm seeing that you've conducted 2,147 tests as at the last count from the NCDC over the course of 2 months, which you've been, fighting against COVID-19 in the country. I know that from time to time, NCDC says, this is a target we're trying to reach, this is a capacity we have, but time and again, we have fallen short of that, and, it speaks to how much states are doing regarding testing. So, as at this point, what is your testing capacity, and what is your major challenge to testing, such that you can have a clear picture of what you have on your hands?
Well, testing, I think, right from the beginning of the outbreak in February, has been the greatest challenge for the entire country. We started nationally with just 5 key testing areas. And now NCDC is saying they have ramped up to about 27, 30 centers. But as far as we're concerned here in Gombe, those centers are still very far away from us, the closest of which is in Plateau, in Jos. And of course, the next one is in Abuja. But, the Gombe state government, under his, the leadership of His Excellency Alhaji Mohammed Inuwa Yahya, has been doing everything possible ab initio, to get that testing facility available within the state. And I think the state government placed order for the procurement of, the PCR, the real-time PCR machine, almost 2 months ago. Of course, because of the global lockdown, it took a very long time for the machine to arrive. And as we're speaking now, we have taken stock of, we have the PCR machine here in Gombe, and the NCTC team came visiting last week. But of course, they made a couple of observations about the space that we have, identified to host the PCR machine. So there are a couple of few things that we need to put together to ensure that Gombe State is now accredited by NCDC, and we have the full capacity to do the testing, and only then we can ramp up, testing to a very significant level. And as it is now, with the over 2,000 cases that we have investigated, if you look at the trend nationally, you'd see that Gombe, with the population of the state, is still relatively, testing much more higher than so many other states, that should be doing that. And so I think testing is generally a huge challenge. And the earlier the government, kind of intervene on this issue, I think the better it will be for us. Otherwise, if you don't test people, no matter how long you lock them down, you allow them to stay within their communities, they are not tested. So you're not able to identify those that are carrying the virus. And then you wouldn't be able to do the necessary intervention of isolating and treating them and making sure that the virus is not transmitted to, other people that are healthy within the community. And if for any reason, this virus gets across to those that have other comorbidities, particularly, we have high prevalence of, chronic diseases like hypertension, asthma, cancer, and so many other things, diabetes mellitus, and many of the people that are dying from COVID infection usually have comorbidities of this nature. And really, that is our greatest fear. And I think most of the deaths that we had in Gombe are also related to those
Dr. Ghana,
that I've mentioned.
Let's end with you telling us what is going on now with the EXCO.
The EXCO of Gombe State?
Yes.
Yeah, so there was a directive, of course, by the executive governor that all members of EXCO must be tested. And yesterday, we spent the whole of yesterday testing the entire EXCO of Gombe State, and official work within the government cycle, especially in the government house, has been suspended until we have outcome of the results. And those results that are coming out positive, of course, will be isolated and will do the appropriate thing. And currently, the contamination activities is taking place within particularly the complex where the lead director, worked, and across the government house clinic. And of course, the governor is also very aware of the situation, and he's in control of the entire intervention that we're doing here. And he's very healthy and working from home. So that's currently what is happening. But of course, other segments of the government is still working because we have no reason to stop those departments, especially to stop coming to work. But the government house in particular is on our focus because we don't want to take anything. We don't want to take chances because he was initially admitted within the government house clinic.
All right, then. Dr. Ahmed Ghana, Commissioner for Health, Gombe State, thank you for joining us today, and all the best as the state handles these matters going forward.
Thank you very much.